Premature atrial complexes, also called atrial extrasystole, is a depolarization originating from an ectopic focus in the atria, occurring before the expected next sinus beat. The P-wave morphology in atrial extrasystole differs from that in the sinus beats. Note that morphology of P-waves before the third and the sixth complexes differs from those of the other beats. Sometimes there is only a minor difference in the morphology of the P-wave. Sometimes the P-wave of an atrial extrasystole may merge with the previous T-wave and may be poorly seen. The P-wave in the fifth beat partially merges with the T-wave of the previous beat. Nevertheless, the P-wave in atrial extrasystole may appear at the apex of the T-wave. Variations in the T-wave amplitude and morphology before the premature QRS complex suggest superimposition of the P-wave on the T-wave. Supraventricular extrasystoles may be frequent and resistant to treatment. Supraventricular extrasystoles may produce bigeminy, when alternating complex is an extrasystole, trigeminy, when every third complex is an extrasystole, and quadrigeminy, when every fourth complex is an extrasystole. Two consecutive premature beats are called coupled extrasystoles. Three or more consecutive supraventricular extrasystoles are considered to be supraventricular tachycardia. However, some authors define three consecutive premature supraventricular beats as supraventricular triplets. There are some samples of supraventricular tachycardia. An atrial extrasystole non-conducted to the ventricles is called a blocked atrial extrasystole. An abnormal P-wave is not followed by a QRS complex. There is a compensatory pause after the abnormal P-wave as the sinus node resets. Sometimes a premature P-wave may be followed by a wide QRS complex with bundle branch block pattern. This is an atrial extrasystole with aberrant conduction. The right bundle branch block pattern is more common. Sometimes it's very difficult to find the P-wave merged with the T-wave of the previous beat. Aberrantly conducted atrial extrasystoles are difficult to distinguish from ventricular systoles. In a patient with pre-existing bundle branch block QRS complex in premature atrial contraction is wide as well. Its morphology is similar to other complexes.
Thank you for watching this video. We hope you enjoyed it. If you want to see more of our videos, please subscribe and hit the like button.